Hi, today I would like to talk about the effects of the COVID vaccines. Um, I've been discussing this a lot in my community with my students and with my colleagues around Europe. And the first thing we feel is that due to the vaccine and also in case of the post-COVID syndrome, um, the symptoms are quite similar. They seem to be, um, for, from a biodynamic aspect, quite similar. So the first thing I feel, and colleagues share this with me a lot, um, is the compression of the fluid body. So that's also the first thing I would treat in a session. And often the people have pain in the arm at the injection site. So I start with a pediater, either with a pediater at that side, or I start with a kind of arm pediater treating the arm. And then for those of you who work with the cardiovascular system, I move to the cardiovascular tree. And I check the cardiovascular system, the tree, and it feels like all the vessels would be very dense and hard, like a water tube system, really like they would be with metal, um, with metal walls. And the position cardiovascular tree can decompress, especially the arteries, but also the veins, in 1, 2, or 3 sessions. But when I feel that the system is not responding in a biodynamic way, it's not moving into another state, I stay very open and try to talk to or try to work on the craniosacral system itself. I try to work on the fluid, on the cerebral spinal fluid, and invite the fluid to increase its potency. I'm sure most of you have techniques for this. Some work with a CD4, some do a very smooth invitation over the parietal bones, some just do it in a very, very non-structural biodynamic way. It's up to you. But these are the 3 postures I would suggest to use after vaccination. And to mention the side effects on a psychological level, we have all kinds of compressions, I would say, also on that level. We have old psychological childhood patterns coming up again. We have jealousy, anger, and we have a common sense of being restricted. And if I talk about the energy level, I would say the crown chakra is more closed and the heart field is restricted. So everybody, I feel, almost everybody, on the heart and cardiovascular level the center of the cardiovascular system is also compromised. So the cardiovascular tree frames and treats the whole tree, but I also keep very much attention on the heart-to-heart connection and going out into space with my heart, and to give the patient's heart also enough space to get beyond these restrictions. Of course, every client needs to be treated individually, but this is just a suggestion how you could start or what you could try to treat patients after COVID vaccination. I hope this makes sense for you. Goodbye.